It is important for you to know that pain is not a disease. Don't pursue it. Did you know that the pain in appendicitis is a golden gift of God to save life? If that very pain is subdued, what will happen is that very appendix problem will continue, and this person may have ruptured appendix. At that time, you start looking for the life of the individual. Let's get right the underlying cause of that very pain. And look at this very text message. Quite an impressive one, I will tell you. She said, please, my uncle has been having stomach pain for 2 months now. He hardly goes to toilet. They say it is poison, which is same they say to me about my fibroid. Please, what is the cause of this stomach pain and not able to go to toilet? Today we are going to answer her, which of course answering everybody, because stomach pain in different fashion, both male and female, present. So can all of us having stomach pain also be considered in the state of the uncle? Now that brings us to the issue of, as she asks, what is the cause of stomach pain in addition to not being able to go to toilet? Now, to help you understand this, check out this. This is the brain, okay? And the brain has a spinal cord that goes down. Do you see that? The spinal cord goes down from the brain through the vertebra down. But see the interesting thing, and this spinal cord sends out nerves, as you can see here. This from the back tend to grab over the organs around here. So they brings about what is called sensation. You can have a feeling, okay, touching something or having a pain and all that. These are the nerves that actually control that. Now, having noted this, I want you to have a look at this. So you can now see the graphic picture of such, coming out as branches of the spinal cord, all right? So if you look at this right now, you can see you have a lot of nerves. And these nerves that come out from the back will now hug in front a number of organs that you can see here, all right? These are different organs. We're going to pick them one by one. So that tells you something. When you have a pain coming from any part of the body, number one is to have understanding of the anatomical location of the organ in question, in addition to the possible nerve also trying to supply that particular area. That brings us to the important fact. Any of these having issue can present as abdominal pain. Sometimes in women it could even be more, because there are organs in women that are not in men. Okay, so number one is that a person that is having abdominal pain, which come to this very region, he may have a kind of indigestion, dyspepsia, heartburn. Such person could have a problem that may come from the chest region, looking at the aspect that has to do with the heart. It could also come from the issue that has to do with the stomach when you have what is called peptic ulcer, as you know. It could also come from what is called hiatus hernia, when there is a problem where the inner lining of the stomach is coming out into the esophagus. So the acid there will be burning that very area. So you have that kind of pain could be there. Someone that is having heart attack could have a pain that comes even up to this much, to the abdomen, because of the interwoven nature of this particular. Now we go further. Behind this stomach, you can also have what is called pancreas. If there is inflammation of that pancreas, call it pancreatitis, or a tumor, a cancer of the head of that pancreas could also be in position to bring abdominal pain. Now, going further, you can also have a problem here that is called gastritis, even appendicitis. And that comes up when somebody is having pain in this right iliac fossa. You go further, and what will paint a closer picture, because all what I'm talking about right now is what is called differential diagnosis. that all these things can mimic each other or could be responsible for this. It is not definitive, because only definitive is when we must have done a proper evaluation. Now, for the story that was told us that this uncle was having abdominal pain, or just pain in the stomach, as she mentioned, and also not able to go to toilet. Something will be turning in the mind of a doctor and say, for this person to be having pain in the abdomen, not able to go to toilet, and obviously this person will be losing weight, because somebody who not able to go to toilet obviously not be able also to eat well, and the pain also will not allow him to eat well, so he's most likely to start losing weight. And that very individual, you should search out for intestinal cancer, where there is what is called cancer of the intestine. It could be rectal cancer, it could be cancer of the sigmoid column, or cancer along that pipe, which is stopping the flow, of the feces. If it is a case of intestinal obstruction, whereby something has suddenly blocked their very intestine, and that very person will not be able to go to toilet, such could also happen. But the actual cause of this thing has to be solved for, not the pain the person is having. Not okay, I've not gone to toilet for some days now. Why have you not been able to go to toilet? Do you understand me? Why have you not been able to go to toilet? Did you know that this very liver, the liver that is here, can also give an abdominal pain depending on how? Even the gallbladder stone, when you hear doctor talk about cholelithiasis, okay? Now, we go a little further. Can't you imagine this? How many things am I mentioning just inside the stomach producing same symptom? That's why it is very, very, very dangerous for you to go on said medication based on the way you feel. That's why most of our people are dying. And knowledge will be in position to help us. Looking at this very person, if this very person can have a very severe pain at this very two flank, coming from a problem of the kidney, it can come as a result of kidney infection, which is called pyelonephritis, or it could be in position of kidney stone. That's why it's very common. And the pain could be excruciating, very, very painful as it were. To a woman, it is important for you to know, apart from all we have mentioned, a woman may have abdominal pain following what is called endometriosis. It could come from ovarian cysts, or torsion of ovarian cysts. It comes from PID. It could come from pelvic inflammatory disease, or ectopic pregnancy. All this could be in position to cause pain in the abdomen. What is the summary therefore? You will need to go for proper evaluation. Please tell your uncle to move to the hospital for comprehensive evaluation. And looking at the most important thing about that, the uncle, the first and foremost thing is now technology says you're gonna see before you see. You can have what is called endoscopy. Endoscopy is a camera that goes through the mouth, can reveal a lot inside the stomach, a lot of what is we have discussed right now. Also, in a situation where for your uncle, you may need to do what is called colonoscopy. That's endoscopy section. You have the gastro and colon, all right? The colonoscopy can be through the anus, go in, and can reveal if there is issue that has to do with rectal cancer and the rest of them. But the treatment of this particular person may even involve the issue of abdominal scan, even the CT scan, MRI where applicable, so all these things should be in position to be properly done. Today's edition is actually tailored towards making us to understand the complexity that is actually involved in human nature, for which you can't just be on self-medication. You can't just be in position to say, no, I have done this, they say nothing. How are you blaming devil? Most of the people that blame him are also in the grave, which means something is wrong somewhere. Share the knowledge you have today to everyone you know. I promise you, there is hope for the healthcare system of this country and continent Africa at large. God bless you as I see you again.